Hello everyone, welcome back to my channel, and the discussion will be done on pneumonia. I recently just had a case of pneumonia, and when the season is changing, a lot of pneumonia cases can come in our day-to-day practice. So we'll take you through what exactly is pneumonia and the pathology and the pathogenesis of pneumonia. We'll walk through the epidemiology. We'll see the microbiology part of pneumonia, and then how the patients will present, so signs and symptoms, and of course then what investigations to go for, and homeopathic therapeutics, what we can do as homeopaths. So when it comes to defining or understanding what exactly is pneumonia, this is basically inflammation of lung parenchyma. So whenever the lung parenchyma is inflamed, that exactly is pneumonia. Now, this actually can be of two types. Either this will be infective, where bacterial or viral or tuberculous or fungal infections give rise to pneumonia. Or it can be non-infective, where sometimes through radiations or poisonings, especially kerosene poisoning, can give rise to inflammation and patient can end up having pneumonia. Now when it comes to the pathogenesis of pneumonia, how the infection is going to end up in the case, there are basically three modes. The first is through microaspiration, meaning two routes, nose or oral, and this one is the most common. Another one is aerosol, so through the air droplets, and third one is blood. Now this route is actually uncommon. Now when we see the pathology of pneumonia, there are basically two versions of pneumonia that we see. First is the bronchopneumonia, and another is the lobar pneumonia. Now when it comes to bronchopneumonia, the patient usually presents with bronchitis, and there will be patchy pneumonia. Usually the middle lobe, that is the most common lobe which is affected, and there will be microabscesses. Whereas if you see the lobar pneumonia, here the complete lobe is involved, so it actually gives rise to massive consolidation. Right, let's go to the epidemiology. There is something called as community acquired pneumonia. What is it? In about 40 to 60% of patients who are admitted to a hospital, so hospital admissions, in those cases about 40 to 60% of the patients, that is a large number of patients, within 48 hours they may get community acquired pneumonia. But in 10 to 30% of the patients, it is usually after 48 hours if the patient has been admitted for longer number of days, or it is ventilator associated. Right. Now I'll just quickly take you through the microbiology or the organisms that are responsible. There are many actually. The first is Haemophilus influenzae, then Moraxella pneumoniae. Now this one is usually seen in COPD cases or who are chain smokers. The third is mycoplasma. Now, usually pediatric cases or young adult cases will present with mycoplasma as more common. Then is Legionella, which is usually seen in geriatric cases, are old patients or patients who are living in homes with defective ACs. Fifth is pneumocystic. Now this is usually seen in patients who are immunocompromised, so cases of HIV or patients who are having CD4 less than 200. Another one is Klebsiella. So patients who are alcoholics or they are known case of diabetes mellitus, and also the old geriatric cases can have this infection. Then is Staphylococcus. Again, this can be post-influenza or in kids. Now, in case of sometimes bird flus through birds, chlamydia can cause. Through animals, it is Coxella. Usually they are infected. And then another one which is rare is histoplasma. This is actually caused by bat droppings. So people who travel to caves, they can get histoplasma infection. And the last is Bacillus anthracis, which is, as we know, is used as bioterrorism. So these are the list of microorganisms that are responsible. Now coming to the signs and symptoms, how do the patient present to us? The list of symptoms generally can vary in each individual case. So the patients usually come with cough with expectoration. They may come with fever. They may come with pain in chest, which is actually pleuritic pain, or this is pleurisy. In case of basal pneumonia, patient can also complain of abdominal pain in abdomen. Patient will have dyspnea, difficulty in breathing. Patient can come with hemoptysis. So in sputa they can come with spotting of blood. If it is rusty, then usually it is streptococcus infection, and if it is jelly-like, red currant jelly-like, this usually indicates Klebsiella infection. And then in atypical infections, the patient can have simply dry cough with no expectoration at all. Now, what are the signs that we must look for on examination? The trachea of the patient will be central, but if it is lobar pneumonia, the patient can have expansion. On expansion, they can have ipsilateral diversion of the trachea. On percussion, the note will be dull because of the consolidation. Vocal fremitus will be increased. Patient will have bronchial or tubular type of breathing, and of course there will be crackles on auscultation. Now when we proceed to look into the case, we definitely want to go for some investigations. So the best initial investigation to think of is chest x-ray. But we have to remember that about 10 to 20% of the cases can be false negative, because consolidation will take few days to develop that kind of opacity that will be evident on the chest x-ray. So the early cases may not have opacity at all. Then you must advise sputum examination or culture of the sputum, and but again the sputum should be good enough to show the adequate number of count, whether WBCs or epithelial cells, but it is helpful in specific diagnosis. You can go for urine antigen test. Okay, you can go for sputa staining. And definitely PCR can be advised. Serum immunoglobulins can be, agglutinin can be advised. In case we are suspecting lobar pneumonia or viral pneumonia, in that case you can go for nasopharyngeal aspirate and rapid molecular test, right? And you definitely can go for culture. Other tests that you can definitely go for is CBC, ESR, which usually will be raised, and in about maybe 5 to 10% of the cases we might need to go for blood culture, or in advanced cases MRI, right? Now coming to the treatment of pneumonia, I'm going to give you a list of remedies in homeopathy that can really help us manage cases of pneumonia. But again, depending on what presentation is there, what are the individual signs and symptoms, the remedy will be prescribed by your clinician, by the homeopathic physician. So starting with the first remedy, which is bryonia, we can think of arsenic alb, antimonium tartaricum, hepar sulf, arsenic iode, phosphorus, ipecac, lycopodium, sanguinaria, bromium, lobelia, carboanimalis, and last blata. So in different potencies, as is the requirement of the case, these remedies can be advised. I hope this much information help you to understand what pneumonia is. Go and study further, go into the details and look into the chest x-rays of the patient. And thank you for watching. Please subscribe, because I'm coming up with more such clinical conditions and detailed discussions. Thank you.